Today's topic is discussing how aging affects your periodontium. Your periodontium has four main components: the gingiva, the cementum, the PDL, and the bone. The first being the gingiva. So now in the gingiva, we have gingival epithelium and we have gingival connective tissue. Gingival connective tissue is predominantly collagen type 1, whereas gingival epithelium was predominantly made up of collagen type 4. The gingival epithelium undergoes thinning, decreased keratinization, increased permeability, and passive eruption with age. Passive eruption is basically recession, in which the junctional epithelium migrates apically. We discussed last time we had passive eruption and active eruption. Active eruption was a natural process that happened in a younger age when your teeth were naturally erupting in childhood, and it was normal eruption. But then we have passive eruption, in which there's not actually your teeth aren't actually erupting, but the junctional epithelium is just migrating apically, so it looks like there is eruption, but it's actually false eruption, which is also known as passive eruption or recession. So the gingival epithelium with age, it gets thinner, whiter, it gets more permeable, and there's recession. Then we have the gingival connective tissue. The gingival connective tissue with age, it gets coarser, denser, which are not present normally in younger individuals. Your gingival connective tissue is neither coarse nor dense, but with age it gets coarser, denser, and there is an increased conversion of soluble to insoluble collagen. And there's also increased collagen stabilization. So normally the collagen in younger individuals is not stable because it's a constantly renewing structure, and it helps to constantly make, it constantly is increasing. Whereas with age, it's stable, and normally it should be soluble, and there's a very minute degree of conversion to insoluble collagen in younger age, but with age it increases. So over here you can see that this is passive eruption. Over here this is passive eruption. Normally this is how it should be. This is the gingival margin. This is as much of the tooth you can see, but with age, you can see more of the tooth, and there's passive eruption. Then we have the PDL. The PDL, what changes can you imagine would occur in the PDL? The PDL is a structure that is constantly, it's not stable. I mean, yeah, it isn't actually stable, and because it has to constantly hold new forces, occlusal forces, during mastication and everything else, all those occlusal forces, it has to compensate them. But with age, there are decreased fibroblasts, increased elastic fibers, increased permeability, and it turns into an irregular structure. And there's also decreased mitotic activity. Now, normally there should be mitotic activity because you're constantly changing the occlusal forces, occlusal pressures that are affecting your teeth, which is why mitotic activity helps in new collagen fibers being made, like transeptal fibers. They're always present even in cases of extreme bone loss and everything. We have transeptal fibers because they're constantly being renewed due to mitotic activity, but with age that decreases. Then the cementum. The cementum with age, a cementum is a structure in which you constantly have new layers being added to it. So with age, there's ankylosis and hypercementosis. Hypercementosis is obviously increased amount of cementum being deposited in the cemental area, and ankylosis is a fusion of your cementum to the bone. The reason it's being fused is because PDL structures are being decreased, and there is an increase in fibroblasts in your PDL. But because of all that, and then you have hypercementosis going on. So because of these things, you have ankylosis, which is a fusion of your cementum with the bone. Then we have accumulation of cemental bays and increased cemental width. Increased cemental width obviously correlates with hypercementosis and ankylosis. We have the changes in your alveolar bone. There's osteoporosis, which is an age-related phenomena in which your bone becomes less dense, slow healing, and irregular surface. These are all understandable. Dental plaque, as your age increases, plaque accumulation also increases, and so it's a directly proportional phenomenon. Treatment, because with age your immunity decreases, henceforth the progression of disease is faster with age because you have less immunity with older age. And that wraps up our topic. I hope you understood.